always get nervous whenever we see the baby just because it's like makes it real.
Yeah, I always get excited.
I'm like, oh, it's really in there. As much as I am happy to be pregnant and I love being a mother, I'm terrified. And I've been through a lot of crap in my life, so I feel like I can get through anything at this point. But I still get scared.
Hi, how are you today?
I'm good, how are you?
Good, come on in.
Today's the appointment where we talk about the genetics and the possible genetic problems that could exist with the baby. It's important to do this at this time of the pregnancy because if there's gonna be problems, then it's important to know, especially in my situation with being high risk in a high risk pregnancy. Hey.
Hi there, how's it going? Good, Dr. Miller.
Jessica.
Good to meet you.
Good to meet you both. Have a seat.
Thank you.
So one of the purposes of today's appointment is to determine if you are at increased risk of any having a baby with genetic defects. So if it's okay, Todd, you said, right?
Yes.
If I could ask you a few questions about your past medical history.
Of course.
There's so many different birth defects that run in the Kingston families. We've got people with Down syndrome, cerebral palsy, kidney problems, heart problems.
Well, let's turn to you, Jessica, and let's talk about your past family history. Any relatives you can think of that were born with congenital problems, chromosomal problems, birth defects?
Problem is there's like everything, but there's just so many people. There's like my dad. So in my biological family, I have like 180 plus siblings. My biological dad has 14 wives, and my biological mom has 12 children. But I've left that, and now I'm adopted into a new family. But I know for this, you need to get my biological history.
Sure, and that kind of complicates the picture a little bit because you probably have a little bit of everything amongst those several siblings.
And they don't always go to the doctor. It's very rare if they go to the doctor.
I see.
So my family history is like very convoluted. Is preeclampsia something that's genetic?
If family members have had it, that puts you at risk as well.
Growing up in polygamy, they always told us if we left, that we would be cursed or something wrong would happen with our pregnancies. And so I feel like, I know I've already taken all the preventative measures I can at this point, but like, I don't get it because of anything I'm doing, right? That's what I'm wondering.
Exactly. Yeah, nothing you're doing has put you at increased risk for it, so.
I've been hiding my pregnancy from people in the order from finding out because if anything goes wrong, all they're gonna do is jump up and say, it's because you left the order. And it has absolutely nothing to do with leaving the order, but I don't need to give them validating experiences and validating information for them to say, if you leave the order, God's gonna torture you. Really, I'm being blessed for not being in the order.
Yep, this is the fun part.
Let's listen to some heartbeat. That's always a nice sound, isn't it?
Always.
I think about my biological mother, Heidi, and her pregnancies. My mom has 12 children, and not once have I ever seen her go to the doctor to get medical care for her pregnancies. And every single one of her children were born at home. I remember the birth of the last 6 of her children. It kind of felt like us kids and Heidi against the world. And then Down show up, but then he'd pop back out. Like he'd show up, play house for a day, and then leave. Me having Todd and me having a husband that actually is attentive and there, I didn't even know what a good husband would bring to my life. But I look at her life and I think she just doesn't quite know what she's missing.
So, size of the baby looking good, heart rate fluid, lots of baby movements. So those are the 4 key things we want to see today on ultrasound. And yeah, I'm really happy with what we saw.
And the heart rate and everything, all that's good.
Heart rate was great. Yeah, you're already doing the right things, and I'm excited for you though, so.
Thanks. Talking to an actual doctor and having a doctor kind of calm some of that and help me realize I'm doing everything I can to be the best mom and have the best situation and the most healthiest pregnancy, then it makes me feel better about everything.
Yeah, we went public.
They drew my blood for the genetic testing and always hoping for great results, and so far I have 2 healthy babies and everything was great with them, so I'm hopeful that there's not gonna be any problems. Every time I see the baby, my nerves are calmed.
Yeah, we're doing what we're supposed to be doing.